working in Chandler Rheumatology and Immunology Center. September, we celebrate Polycystic Ovarian Syndrome Awareness Month. This month particularly we celebrate so we can spread awareness about this one syndrome which is on the rise. Initially, people were unaware of this condition, but every single girl you speak to nowadays, starting from her middle to high school, they are very well aware of what is this condition. Like the name suggests by itself, polycystic ovarian syndrome. Polycyst, multiple small cysts in the ovaries. Like in the female reproductive organs, there's a uterus, there are 2 tubes and 2 ovaries. The function of the ovary is to produce oocytes. In the ovaries, due to some hormonal disturbances, there will be development of these small cysts, which leads to development of the syndrome called polycystic ovarian syndrome. Well, polycystic ovarian syndrome, as such, is a mixture of multiple clinical features. It is not a cyst per se. If it's like a misnomer. When you talk about a cyst, like an ovarian cyst, there can be an endometriotic cyst or a benign or a cancerous cyst. But here, these are small pockets of fluid-filled cysts in the ovaries. And predominantly, they will arrange along the peripheries of the ovaries. So today, we will be talking about what is PCOS? Why is it that it is increasing very high these days? And what are the common signs and symptoms of PCOS? Well, very frankly, most of these women who have PCOS are not clinically diagnosed. The reason why they approach a gynecologist, just to give you a clinical scenario, is they come because they miss their cycles. They haven't had their cycles for around 3 to 4 months. So that is the main reason they visit a gynecologist. Most of these PCOS are seen in a reproductive age group. That is, from the time they get their menarche and in their reproductive age group is where we usually see women suffering from PCOS. So in PCOS per se, there's a lot of symptoms which comes together because of the imbalance in the hormones. Now, as to why this is happening, I will be discussing this with you all. But initially, I would like to tell you what exactly is this PCOS. Now, clinically, I told you this is what happens. But what are those symptoms or what are those features which has to be put together too for PCOS? Multiple organizations have different definitions for PCOS. Predominantly, we talk about the symptoms mainly is anovulation or absence of period. Anovulation is when there is failure of release of a oocyte. That will lead to amenorrhea or absence of period. So absence of period, when it comes, that is when usually girls visit the gynecologist. The second of which what they usually notice is acne. Acne are predominantly difficult to treat acne. Thirdly, there will be obesity. Many of them ask me, is it only obese? No, there is also lean PCOS. Obese PCOS is much commoner than the lean PCOS. So obesity is the other characteristics in polycystic ovarian syndrome. Along with that, there will be excessive secretion of male hormones that will lead to hirsutism or excessive growth of facial hair. Pigmentations predominantly on the neck, underarm, the inner aspect of the thigh. These pigmentations are called acanthosis. They are thickening of the skin, which leads to a darker pigmentations. So there are multiple features which has to be put together. We mainly talk about hyperandrogen status. We talk about the ovarian dysfunction. We also talk about the scan. In the scan, we have to make sure that there is featured polycystic ovaries. And we talk about the condition which can kind of mimic PCOS. So after characterizing, collecting all the information is when we will be able to diagnose the person as PCOS. Now, the common thing, the signs and symptoms of PCOS. Predominantly, what we have observed is the first common thing why they visit a doctor will be because of absence of their periods. Initially, it may start becoming irregular. Cycles, which is around 25 to 35 days, the girl used to get, it is progressively going on increasing. So she's getting her cycles once in 45 days or 60 days. Over a period of time, when the hormonal disturbances goes on increasing, she may go into a failure of having her cycles, that is amenorrhea phase. So 3 months, 4 months, she's not had her cycles. Pregnancy test is negative. So in these cases, some of the patients may require medical assistance to cause bleeding. So that is the first symptom, sign with which they usually visit the doctor. Apart from this, we also look for the other reason why they go to the doctor is the dermatological features. First of which is acne. Difficult to treat, very resistant acne, and it is rapidly progressing. Second is hirsutism, or increase in the facial hair, coarse facial hair. Third one is balding, hair loss. Most of the PCOS patients will definitely complain of hair loss. So they will also complain of balding. The next will be excessive secretions of the oil in the face. And also the other feature which I just explained to you, acanthosis. That is increasing pigmentation or thickness of the skin, predominantly in the neck, underarm, inner aspect of the thigh. So these are the common features. Just to repeat the dermatological features: acne, hirsutism or excessive facial hair, oily skin, acanthosis or pigmentations, hair loss, balding. So these are the common features with or dermatological manifestations for PCOS. The next one is, as I already told, menstrual. It need not always be just amenorrhea or absence of period. The cycles kind of become very irregular. Recently, in one of my OPDs, my patient came and said, "Madam, if I exercise properly and if I am extremely cautious about my diet, my cycles do come regular." Well, the answer is just given by her. Yes, by having a lifestyle modification, it kind of regularizes. So what we always say is we have to put in our effort also. So it need not always have to be amenorrhea. It can be irregular cycles, once in 2 months, once in 3 months, once in 4 months, again once in 45 days. So cycles become irregular. It can be oligomenorrhea. Oligomenorrhea is when the bleeding is lesser than normal. We usually tell how many pads a girl is supposed to change or how many days the bleeding is supposed to have. When it is lesser than normal, they can present with oligomenorrhea. Along with that, some of them can also present with menorrhagia, that is excessive bleeding. So the combination, it can be irregular cycles, it can be amenorrhea, it can be oligo, or it can be menorrhagia. So these are the common features with which they usually visit the doctor. So when we talk about polycystic ovary, is this the only one? Are there any other additional features that we have they may present with? In a reproductive age group, the main concern for them will be fertility. So yes, another reason why they visit a gynecologist will be for fertility issue. Infertility is definitely caused by PCOS, a manageable cause. So a girl who's planning for pregnancy, because of anovulation, it may be difficult for her to conceive. And some of them will definitely respond to the medication, lifestyle modification, dietary changes, increase in physical activity. But some of them may also require medical intervention and also surgical interventions. Most of them, along with these symptoms, that is dermatological manifestation, cycle abnormalities, and infertility, associated symptoms also they can start having. Psychological impact of PCOS is pretty high. And it is very nice that girls are accepting the condition and they're taking active measures towards this. Most of the talks when we do in colleges, in colleges and the schools, they're very open-minded about it. Everyone is aware of what is PCOS. Psychological impact of PCOS is pretty high, mainly because of the skin changes and the weight issue. So these are the two reasons, main two reasons why they have a lot of psychological impact. So definitely addressing the primary cause would help. Apart from that, they will also have metabolic. We also say some of them, or over a period of time, PCOS can develop into a metabolic syndrome. That is, when the patients come, you tell them, see, this is the status, this is the present status. And if there is PCOS, there's always multiple studies which says that that girl will be more prone to developing gestation diabetes in her pregnancy. Also, diabetes later on in her life, obesity leading to cardiac issues and hypertension. So if PCOS is present, along with that, as it progresses, it brings along other metabolic conditions in the form of diabetes, hypertension, cardiac problems, lipid, that is hyperlipid or cholesterol issues as well. So these are the other symptoms which can be associated with this. Sleep disturbance is another important presenting feature of PCOS. So this is commonly what are the features they come with. Now let's go into why. Why is it on a rise in our country or overall? Rather, all over the globe, there is a significant increase of PCOS. And that is the main reason why PCOS month is been celebrated and is aggressively being promoted. Lifestyle. Lifestyle changes is one of the main reasons why there is an increase in PCOS. Restricted physical activity, unbalanced diet. So when a patient usually comes to us and we diagnose her as PCOS, we always tell her, please understand, it has to be, if 50% of the effort is put by the medications, 50% has to come by you. Rather, I would say 80 to 90% of the effort has to come from them. They have to put a little bit more effort. Yes, whatever additional help is required can be done. So in the form of change in physical activity, they have to get a little physically active. It did not have to be gym or aerobics. It can be one particular form of physical activity. It can be yoga, it can be aerobics, it can be hitting the gym or going for a good walk. A 45 minutes of brisk walk also is good. Along with that, the diet, definitely. To cut down on refined sugars, maida, processed food. These are things we have to reduce. So a lifestyle modification is one of the changes, is one of the main reason why PCOS has a rise in the number of cases. But if we talk about what are the who are the people who are more prone for PCOS, definitely we say there is an impact of genetics. So if a girl comes with PCOS, I would definitely take a history of her family, mother, sister, anyone having a PCOS along with it. Apart from that, as I already mentioned about the diet as well as the exercise. The other one is the environmental impact. Also is having a significant impact in the increase in the number of cases of PCOS. PCOS has to be addressed not just for the present state. It's not just for the person to start having a regular cycles. It is so that she can prevent complications later on in her life. Some of them, when we actually Google, and for curiosity, even I had Googled sometime to find out, and they say the risk of having polycystic ovarian syndrome. The first one said endometrial cancer. And well, I was like, let's calm down. It has to be addressed. This condition has to be addressed because of a long-term exposure of a hormone called estrogen. The person will be more prone or will be in the risk of developing as endometrial cancer. But the complications, what we are usually seeing would be obesity, first and foremost, very difficult. That later on leading to cardiac disorder, hyperlipid or cholesterol, hypertension, and diabetes. And when this girl who's having PCOS conceives, she's on a higher risk of having diabetes in pregnancy. Yes, many multiple studies have proven that it can cause endometrial cancer. As I already said, it is because of the increased exposure to certain hormones. So in our today's session, that is on the first day of the awareness month for PCOS, we have concentrated mainly on what is PCOS, what are the signs and symptoms. Progressively, we will be talking about the other features in the form of how is PCOS diagnosed? What are the various management for PCOS? We have a series of programs scheduled this month in the form of yoga for PCOS and the diet for PCOS. So I hope this talk was knowledgeable, and thank you.